Welcome to Evolve's parent webinar. My name is Allison Orsina, and I'm a licensed marriage and family therapist in California. And I've worked for close to 15 years now in mental health and have been licensed since 2012. And in my time in this career, I've come to specialize in adolescent treatment, in residential treatment, and in a niche of treatment called dialectical behavior therapy, and working specifically with teens who struggle with emotion dysregulation, suicidal behaviors, and sometimes borderline personality disorder. So this is a clinical passion of mine. And in addition to having a passion for supporting teens with these experiences, I also have a lot of passion in helping families of teens who have these experiences. It is a challenging experience for all involved when someone in the home struggles with emotion dysregulation. And I think everybody who's encountering this deserves compassion and support, skills, and guidance to help navigate this. For those that are curious, we are recording this webinar and we'll have this posted within a few days of this webinar being concluded. So if you want to share it with others and go back and reference it, you'll be able to do that at that time. So first, I want to say that I'm really glad you're all here. If you're in this webinar, it likely means that someone you care deeply about struggles with emotion dysregulation. And to love someone with big emotions can be really challenging. It's not something that we're taught when we become parents. I am, as a side note, I'm a parent myself, and I know firsthand there's really no way to know how to do it until you're in it. And if your child has different needs than other children, there's a especially big learning curve at play. And that if you love and care for somebody with big emotions that are hard to regulate, you're probably wanting solutions. Maybe feel burned out, frustrated, even helpless around what to do to help your child. And it's okay and understandable to not know how to do that. We're not born knowing how to do this. We need other people to help, hold our hand and teach us, so that we can go on and help our loved ones and maybe even teach someone else that we care about how to do this. The good news is that while this is exceedingly difficult, there are things you can do to help your teen and to help yourself with the process. And that's what our webinar is going to focus on today, is how to deal with a teen who is emotionally dysregulated or who struggles with that issue. And we'll talk about some tangible skills for doing that. But first, again, I just wanted to acknowledge and validate that this is really hard and you're all doing the best you can and just need more tools. That's why we're here today. So to talk about the idea of emotion dysregulation, we have to first start more basic, with a thorough and clear understanding of what emotions are. So here is Emotions 101. We may have a basic idea of what that is, but given that I'm operating from a DBT standpoint in my clinical experience, I'm looking at this through the lens of emotions being what we call a full system response. That not only is it the subjective feeling that we have, but it incorporates so many other things too. Our cognitions or our thoughts are involved in our emotion experiencing. What we're experiencing inside our bodies is incorporated into this, meaning like our body sensations, like muscle tension, our skin feeling hot, feeling tingly or numb, or feeling sick to our stomach. These are all body sensations we might be experiencing when we have different difficult emotions. Our urges are a part of this full system response, meaning the urge to engage in behavior, for example. On the external end of things, the emotional system response can look like our body language, what other people can read on our face and what we're doing with our bodies, and even our words and actual actions. So when you look at these things all together, this is the emotion experience. And in DBT, we believe that all behaviors, including emotions, are caused, that nothing really happens truly randomly. It may be harder to suss out what certain causes might be. At the end of the day, there is a cause for everything. And so when we think about emotion experiencing, we think about prompting events for those emotions. And oftentimes that's some sort of trigger or cue in our environment. So when we're noticing our own emotions, it may be helpful to think about how you're experiencing this with your full system. So cognitively, behaviorally, in your body, etc., to start to really connect with the idea that this encompasses so much of ourselves. In thinking about emotions as a truly full system response, we also need to understand how emotions come and go throughout our lives. There is a common misbelief that an emotion may be triggered and that you might experience that emotion on a continuous basis, either at the same intensity over time, or sometimes our clients will even tell us at Evolve that their emotion seems like it just goes up and up and up in intensity to infinity. That's not how these work. Emotions, much like our urges that we experience internally, do have a time limit, so to speak. They tend to happen in waves. Now, sometimes those waves are a very sharp peak and decline. Sometimes they're a very broad and wide wave with a longer tail at the end, meaning it takes a longer time for those emotions to come and go. But at the end of the day, we're not ever really experiencing an emotion perpetually. We may have peaks and valleys in intensity. They may go away entirely, but it's never completely static or unchanged. And the reason that this is important to point out when discussing emotion regulation is because people with intense emotions tend to feel like their difficult emotion experiencing is never ending. They keep getting hit in the face with it over and over again, and they may deeply believe that their emotions just keep getting worse and worse all the time. Or something we hear often is that I've felt this bad forever. Now, I don't want to discount that experience, because what that communicates to me is that this has been a pretty miserable experience, and I need to understand what that looks like more. But we want to give people the understanding that emotions can be changed, that there's something that will come and go without us doing anything about them, and that as for people who care for others with emotion dysregulation issues or people with really big feelings, we need to understand the process they're experiencing when they're getting hit with these big waves. Now, throughout our lives, we're we're conditioned based on our social environment to cope with emotions in a variety of ways. And that can land us when we're in our adolescence or in our adulthood with kind of falling on this spectrum of emotion experiencing. So on the left side of the spectrum, we have folks who are overly controlled in their emotion experiencing. This means that emotion experiencing or the expression of emotions may be considered a no-go. I mean, this is aversive in some way. It's undesirable for whatever reason. And so emotion experiencing is kind of stuffed down. And to the point where some people even have a hard time identifying what they're currently feeling, where emotion expression or experiencing has been made that aversive for them in their lives based on learned experience. On the other end of the spectrum, on the right side, we have folks who have more out of control, or what we call emotion discontrol, where big emotions are happening constantly, big waves of emotion, and there's a lot of difficulty in regulating them, meaning not knowing what to do when they show up, not knowing how to prevent them. What our goal is to have us, have experience somewhere in the middle where we have safe and effective emotion experiencing, where we know what to do when difficult emotions show up. We don't want to try to stuff them in a box and never experience them, but we also want to know how to change them or how to tolerate them should they appear. So when looking at this spectrum, it's helpful for you as a caregiver to notice where you might fall on this spectrum and how this may impact your relating to your teen about their experience, especially if you and your teen fall on very different ends of the spectrum. How that might impact your communication around emotions and how you may support your team in managing their emotional experiencing. And again, with emotion regulation skills training, our goal is always to get somewhere in the middle, this place of balance. An important thing to note is something called the biosocial theory. This is something we talk about in DBT, and that is a theoretical basis for our DBT treatment model. Marsha Linehan incorporated her beliefs in her first treatment manual based on research at the time. Her theory was that people are born with biological temperaments, and that sometimes those temperaments may be more sensitive, maybe more impulsive, et cetera, and that person's biological temperament is either kind of played out or suppressed based on the environment that they're in. Some subsequent research has supported this, that there's even some biological phenotypes at play that some infants may have, in that this genetic expression is heightened or suppressed based on the environment that they grew up in. And so for someone with this biological temperament, for some people, this means having a much higher emotional vulnerability. This may look like much more intense emotion experiencing. So the big feelers, even from infancy or toddlerhood or school-age children, experiencing emotions much more intensely than other children. It may look like high emotion sensitivity to things in the environment, meaning that as they're navigating the world, daycare, school, siblings, instructions from parents, that there's much more there that's an emotional minefield than it would be for other children. And we see with these kids as well that it may take longer for them to calm down once a big emotion is triggered. So that means one of those broader, wider emotional waves with a longer tail. Some kids may take hours to calm down after an intense emotional experience, where others may return to baseline within a few minutes. And so when we have an infant or a small child that has this biological temperament and this emotional vulnerability, they require a very specific parenting style to be able to learn how to regulate their emotions, how to tolerate distress safely, what to do with this emotional experiencing they have. And frankly, most parents aren't given the tools to be able to support their child through that. And so even the most well-meaning parents may go through their child's childhood being like kind of floundering with, what do I do? How do I manage this? Why is this happening? And so then we reach adolescence, and some of this temperament has manifested into problematic behaviors like anger outbursts or self-harm, or sometimes contemplating suicide or difficulties in relationships. And now we're at the point where we got to figure out how to help our child manage this. So like I mentioned, this all happens with childhood learning. So how we respond to a child experiencing intense and painful emotions really shapes how they learn to regulate them. So the idea here is a child expresses an emotion that's triggered by something in the environment. The child expresses their emotion in a certain way. The parent has an emotional response to that and then responds to the child in kind. The child then has another emotional reaction to the parent and responds in kind. So you can see this may have what we call a transactional, or kind of like a snowball effect, where if we're responding in a way to our child that produces more dysregulation, or communicates that their emotional experience is wrong or trivial in some way, then the child's going to not know how to label their emotions. They're going to not know how to regulate their emotions when they show up, and the cycle will continue. So our job now is to figure out these pain points here where we can intervene differently. And that's where we bring in our emotion regulation skills. So what is emotion regulation? I've mentioned this a few times, but to lay it out even again, because it's so pivotal to this training, emotion regulation starts basic with simply noticing and labeling and understanding your emotions. Okay. These are things our children learn to do when they're little, right? We might reflect, hey, I see that someone took the toy you were using. It looks like you might be feeling sad. Or how do you feel today? I know there's a lot of focus on social emotional learning in like preschool and daycare settings to help children foster these skills. That's a basic and required component of emotional regulation. 2, it involves preventing vulnerability to difficult emotions. This means really learning about yourself and what tends to make you more susceptible to big waves of emotion and not knowing how to handle it. So preventing this vulnerability often looks like taking care of your body and your physical health so that you're not having difficulty remaining effective when you're feeling physically terrible. It may look like, intentionally spending time around people that are in line with your values and people that may support your emotional well-being. And 3rd, it involves responding to difficult emotions. So once the difficult emotions show up, what do we do about it? So here's a very basic idea of what regulation would look like. So someone experiences some sort of cue in the environment, something happens, it triggers an emotion. We then notice the emotion, whether we say it out loud or we even have the thought in our head that sounds something like, I'm feeling sad right now. We then have some options of what to do with that. One option is to simply tolerate it, to notice that we're sad and let the wave rise and fall on its own. That's one option. Another option might be if the emotion is very intense or interfering with other things that we have to do to function in life, we might want to use a different coping skill to try to change how we feel in that moment. Either way, eventually we will return to baseline. And then the cycle may start again when we experience another emotion. But you can see there are ways to manage it to where this is not going to feel out of control. In fact, we're always ending up returning to baseline and hopefully without any damage caused by our emotion, like, engaging in one of our problematic behaviors, for example. Dysregulation occurs when emotions spiral out of control. Okay. So where we may not even notice or label that the emotion is there, it might involve impulsively jumping to a problematic behavior. It might mean that we don't have the ability to tolerate riding the wave of the emotion. Instead, we try to cope with it by engaging in self-harm or using substances, etc. And it ends up feeling like you keep getting hit with waves of emotion over and over, and it's hard to keep your head above water. For folks that tend to be on the emotion over control side of the spectrum we discussed earlier, what can end up happening here is that emotions are suppressed and suppressed and suppressed until you just can't do it anymore. And then there's an explosion that typically involves some sort of undesirable behavior, like one of our teen clients' target behaviors. So either way, like, this approach isn't sustainable, right? There's a lot of problematic things that result from emotion dysregulation. And so, again, our goal is to have the balance in between those two ends of the spectrum where we're noticing and labeling emotions, preventing vulnerability to difficult emotions, and then knowing what to do when difficult emotions show up. I think it's important to emphasize here how deeply chaotic and painful and miserable it can feel to be in this rocky sea of painful emotions. It can truly feel for someone who struggles with this that they can barely come up for air. And for some people with severe emotion dysregulation challenges, this can be a process throughout the day, every day, where they're hit with anxiety, they're hit with anger, they're hit with constant irritability, sadness, and it is a roller coaster that is miserable to be on. And if they could get off, they would. And so that's why, with people like us at Evolve, we're there to help give the tools to our teen clients to be able to get off that ride and find a different way to cope with all of this. And as parents, you having the insight and tools also to know how to help them get off that rocky ride. So, in contrast to the emotion regulation cycle that we looked at here, or in the previous slide, here with dysregulation, we have an emotion, and then a person may or may not notice it at all. Maybe they notice it and say, "I'm really upset right now. I can't handle this," or they might not even consciously acknowledge it and jump straight to urges or behaviors. Either way, instead of tolerating or regulating, we're jumping to behaviors to try to cope with the misery, the emotional misery that's present. And typically we're seeing a slower return to baseline and again, stuck in this rocky sea of emotions. And for some, when we have engagement in one of these problematic behaviors as a result of an emotion, it sends us into this cycle again, because now we've triggered a secondary emotion, sometimes guilt or shame. So if your teen is really angry because you just told them that they can't have access to their cell phone all weekend, they might instantly feel intense anger, and they might scream, they might yell, they might punch a wall, they might make threats like, "If you don't give it to me, I'm going to kill myself." And then as a parent, you might, that might impact you emotionally and might have your own response, and your child might continue to feel angry. They might end up feeling sad. They might also end up feeling guilt and shame. And guilt and shame are really challenging emotions for most people to tolerate and regulate. And that can lead them through this cycle again with other problematic behaviors as well. And another piece of this is that when you're engaging with your teen, the dysregulation itself can be dysregulating, and that your dysregulation will likely come into play, because it's hard to stay regulated when someone's yelling at you, when someone's hurting themselves, when someone's making threats, all sorts of behaviors that can come from your teen when they're emotionally dysregulated. That's hard to tolerate as a parent. You may be furious with them. You may be frustrated. You may feel helpless. You may feel deeply sad that they're continuing to do this. And so it's understandable that the teen's dysregulation, their behaviors may then lead to your dysregulation and then your behaviors, which if those behaviors are defective either, that can send teen into additional dysregulation. Okay. So you could see this could be an ever perpetuating cycle that can really cause a lot of harm over time. And what happens is when there's a system like this where everyone doesn't have the tools needed to do something differently, what happens is teens' ineffective behaviors are reinforced, parents' ineffective behaviors are reinforced, and this gets worse and worse over time. So what do we do? So as I've shown in a couple of slides, this is a cycle. This is a cycle that happens and is repeated over and over again because you don't even have the tools to know how to intervene differently. So some of the key phrases I'm going to be talking about as I go through the actual application of what to do is stop and slow down. That is these are some of the most helpful things I can reiterate to you, because when we're reacting quickly or impulsively or based on emotion alone, we're probably not responding in our most effective way. So much clarity can be given simply by taking a moment to slow down. That's one of the biggest things I can advise you on. I know as a clinician and someone who's been working with teens and doing family therapy and groups and so forth for years, I know I have to slow down. When things are heated in the room, or a client is yelling at me or is making threats towards me or what have you, I'm slowing down to make sure I'm noticing my emotions, thoughts, and urges. I have to do that if I'm going to have any chance of being able to regulate myself. And if I'm not regulated, I'm not going to help the other person be regulated. I won't have the capacity to do it. And I might be so driven by emotion that I might end up doing something that's really, really unhelpful. Additionally, if you're modeling slowing down and taking a really purposeful approach to whatever problem is in front of you, you're modeling that for your teen, that this is what we need to do when things get heated. So stop, slow down, notice your emotions. So check in you're basically doing a brief scan of yourself. And this doesn't have to take 5 minutes. This can be fast, and you'll get more experience at this over time. Check in with your emotions, what thoughts are running through your mind, how your body feels. Sometimes it can be a big clue about what's going on with you. If you just notice, are your shoulders up to your ears, or is your jaw clenched? Are your fists clenched? You feel hot? That'll give you a moment to notice and take a deep breath to let all of that release before proceeding. Gonna need to regulate yourself, okay? And then proceed with supporting your teen with regulating. So some pointers in how to regulate emotions. So this is not just, I'm giving this advice to you because you're going to need to know how to regulate your emotions, but this is also applying to your teen that you're trying to support. These are just general tools that as clinicians, like in DBT, we use all the time ourselves as well. We have to. We're going to be effective clinicians working with teens who have out of control emotions. So as I mentioned before, we need to take steps to prevent vulnerability to intense or out of control emotions. This looks like getting enough sleep, okay? Making sure you're practicing decent sleep hygiene at home. I know, being a working parent, it can make that very difficult. Having other children in the home that have needs or even that have special needs, that can be very difficult. And it's so important for you to be able to have the foundation to endure all of this and to be able to navigate through it. It looks like eating balanced meals. Again, you're also modeling this for your teen, making sure you're eating 3 balanced meals a day, that you're not skipping meals or overeating, not overdoing it on the caffeine, generally taking care of your body. I think that oftentimes when parents are in unrelenting crisis, the self-care takes a back seat out of necessity or out of just complete burnout, which is understandable. And to be your most regulated self for your child has to start with you taking care of yourself. So making sure you can exercise when possible, that you're going to your doctor if something's wrong, that you're getting the rest you need. Second, taking steps to safely experience your emotions. Okay. So when you're noticing frustration, anger, sadness, shame, guilt, whatever it may be in your interactions with your teen, allow yourself to experience that emotion. Don't shut it down, okay? And don't allow it to spiral out of control. So this can help you in the process, but it's something you can also model for your teen. I notice I'm feeling really angry right now. Even just saying that is modeling for your teen that it's okay to have this emotional experience and stay calm and effective while you're doing it. We want to make sure that your emotions aren't spiraling out of control. So having your own supports in the background of your helping your teen to help you know what works for you to stay calm. If you struggle with intense emotions as well or aren't really sure how to manage your anger, then that's something that has to be really in place for you to be able to help your teen with this. take back control of your emotional experiencing. So create positive emotions. So one of the things that people with difficulties with emotion regulation talk about a lot is feeling like they have no control anymore. Again, this isn't the people that are on the over control side of the spectrum. These are the people that are in a constant rocky sea. It feels like they have no control over this. They're just getting slapped around. And so we want to remind them that they can take back control and do things on purpose to create positive emotions. You can do that as well. And in fact, there's instructions in one of our DBT manuals for adolescents on shared parent-teen pleasant activities that you can do together to take back emotional control and create positive emotions together. And then, of course, changing your emotions when needed as well. So it's a little bit beyond the scope of this training to teach the specific skills for emotion change. There could be a whole other training on that and those skills from DBT. I'm going to focus on a couple aspects of that, of what to do in the moment of dysregulation that you can use instead. So step 1, regulate yourself. Again, I really encourage you to have your own helpers and supports to help you navigate and identify what coping skills work best for you as an individual in regulating difficult emotions. I strongly encourage parents to be in their own therapy when navigating this because it is very challenging and emotionally trying. And you need your own support too to be the most effective parent you can be. So step 1 is regulating yourself. When your teen is dysregulated, behaving ineffectively, as you notice yourself start to dive into dysregulation, one skill I do highly recommend is a skill called the STOP skill. This is a DBT distress tolerance skill and helps you to get through a crisis situation without making it worse. And it's easy to make things worse when things are heated, right? So the first step is stop. Literally stop what you're doing, stop talking, stop doing, and take a step back. This could mean literally like tell your teen, I need a break. Can I get 5 minutes? And then we can come back and talk about this. Or mentally taking a step back to pause and think about what's happening and observe. The observe piece is really important here. We're using what we call mindfulness skills in DBT, where we're noticing our current experience. What am I thinking? What am I feeling? What am I feeling in my body? What do I have the urge to do? And once we scan and observe all of that, we can choose how to proceed with mindfulness instead of flying off the handle, responding impulsively, etc. I cannot recommend this enough as like a basic skill to use when things get heated with your teen. During your process of regulating yourself, then there are several things you can do to help your teen regulate. And again, I recommend you seeking your own help to learn the ins and outs of what works for you in terms of emotion regulation and, doing what you need to stay calm and effective in those heated moments. Here's what you can do to help your teen in those moments. And moments meaning when your teen is experiencing a big and challenging emotion, when they may be acting ineffectively, or sometimes even when safety is a concern. So a bunch of things you can do. Starting with validation. This is a core skill in DBT and it is essential in relationships and in supporting someone with big emotions. We want to avoid judgments, avoid extremes, wait to problem solve, and take breaks when needed. So I'm going to take a look right now to see if there's any pressing questions on the content so far. Give us a real example of you not recognizing an emotion. What are the common circumstances? That's a good example. I mean, we see this often with our clients at Evolve. And sometimes it may look like we may have an idea of what they might be experiencing because we can see it on their face and their body. right? But for whatever reason, the teen is not able or willing to name it with us. Now, some are really have an idea of putting a word to their experience. And sometimes we'll take out an emotion wheel with like a ton of different emotion words on it that they can scan and be like, yes, that's it. That's it. Sometimes we have to kind of help the teen pair certain body sensations with typical emotion experiences. So they can kind of, if they're more in tune with how their body feels than what their particular emotion is, we can help kind of seek a backdoor to figuring out the emotion by saying, how does your body feel? Oh, I feel sick to my stomach. There's a lump in my throat. You're like, that might sound like anxiety. For other kids, it's more that they find the experience of expressing their emotion very threatening. And so for whatever reason, emotion expression has not been supported in the past. And so when they have a feeling, they feel really fearful about sharing that. And so in order to counter that, we may need to give a lot of positive reinforcement for emotion observation and labeling, which we do in a bunch of different ways in our programs that Evolve. I think some of the questions I saw will likely be addressed in the slides to come. Okay, what is validation? So validation is an extremely important concept in DBT. It's something that we utilize with our clients often in helping them feel accepted and helping them to understand what's going on with them and to really build the relationship in therapy so that they will have the motivation that's needed to create behavior change. And a lot of times people with intense emotions have been chronically invalidated because others may not understand or anticipate their big emotional experiencing. So at its core, validation is communicating that someone's experience and responses make sense given the circumstances. It involves actively accepting another person in this moment before trying to change whatever's happening and taking their experiences and responses seriously without dismissing or trivializing them. So when a teen, when your child comes to you at school after school and says they're devastated because their friend said something mean to them, and they explain what the friend said, and you're like, that doesn't sound so bad. Why are you so upset by that? That's likely going to make the teen feel highly invalidated because whether or not that's how we would feel in that situation, the reality is that that's how the teen feels in this situation, that they feel deeply hurt by it in their experience, that's what's real for them. So a validating response would be to acknowledge, hey, I understand. I hear you're saying that you're really upset by what so-and-so said to you. Now I can understand being upset with a friend who's said that. You may not have felt that that's how you would respond, but it's clearly very real to that person. And it means taking their responses seriously. So when we say, oh, you're so dramatic, this doesn't seem like that's such a big deal. Can we move on? Right? You have to sit with their experience and really understand the truth behind why it's so upsetting for them. And listen, it's possible that this is an emotion and intensity that doesn't fully fit the facts. We may uncover that later, but in this moment, we have to pause first in validating their experience, or otherwise they're not going to know, they're not going to feel like you trust their experience or you care enough to help them further. So this is very, very key. So validation helps maintain relationships. This is a core part of any relationship is being present for somebody, saying you understand, that you get why they're feeling a certain way given the circumstances. Validation takes away the pressure to prove who is right and who is wrong in an argument. because instead of doing that, we're focused more on really trying to understand the other person's experience and the kernels of truth in that experience. When you're upset with somebody, everything they're saying might not be factually correct, but there's something about what they're saying that is very, very true. And there's a truth for them that is important to acknowledge and honor, so that person feels heard. Validation also helps you to regulate you and your team. When you're taking the time to find the kernel of truth in someone else's experience, that really compels you to have compassion and empathy for what they're going through. And when you're validating others in that way, it can help regulate you. I know this is an experience that I've had with clients at Evolve, where if I'm feeling very frustrated with a client, I may make an extra effort to validate them and to really connect with their experience. And in doing so, I feel less angry with them. I feel less frustrated with them when I connect with what it must be like to be in their shoes. Invalidation is very painful. And so it's something we have to work hard to avoid in our relationships. So some basic ways to validate: fully and actively listen. So be fully present with somebody, make eye contact, don't multitask, don't look at your phone while they're talking to you. Reflect back what you're hearing. That way they know you're at least making an effort to understand. Even if it's clear you don't fully get it, this is a way for you to say, I think you're saying this. Is that right? That shows that you're really invested in what they're saying. You want to read between the lines sometimes. If so-and-so is saying they're fine, but they look terribly sad, they're slouched, they have a frown on their face, you might say, I hear you, you're saying you're fine, but I'm wondering if you might be feeling a little sad today. That shows that you're really attuning with what's going on to them and that it matters to you. You want to acknowledge how their experience makes sense, given either current circumstances or things that have happened in their past. If your teen maybe had a very challenging or even traumatic experience in the past, and now they're wanting to avoid things that remind them of that, it makes sense that they would want to do that. It makes sense that you would want to avoid something that prompts deep fear or anxiety in themselves. Doesn't mean that it's necessarily effective for them to keep avoiding that forever. And they need to know that this emotion makes sense given the circumstances. And we really want to be genuine with others. We want to be our authentic selves with people. That communicates openness and trust, and that we're not trying to one-up ourselves over others, or that we're communicate that they're less than in some way. We just want to be fully genuine and authentic. Judgments. When we're in a heated moment with our teen, it's easy to jump to judgment statements, right? I can't believe you're doing this again. You always do this. You're so whatever. Insert whatever word. That's understandable for our own emotion minds and our own heads emotions to cause those kinds of statements. And the problem is that they really intensify emotions and lead to more dysregulation in the process. When we judge, we really stop observing and being open to what's really in front of us. We can't fully understand the problem if we're only convinced our judgments are true. It could lead us to be highly invalidating to our teen, and it often can make attempts at support really ineffective. So, how can we reframe away from judgment and towards validation? Okay. So, an unhelpful statement might look something like, you shouldn't get so upset, calm down. I mean, that's the last thing anyone wants to hear when they're upset, is to calm down. That can be triggering in and of itself. But instead of these words, you can have a reframe like, I can tell that you're really struggling. How can I help you? Okay. So again, we're reading between the lines, seeing that they're upset, acknowledging that, and expressing the desire to help. We're not telling them to change or to stop. We're just saying, how can I help? That can be much more disarming than further dysregulating. Another potentially unhelpful statement: you're being so disrespectful. I mean, of course, like these are judgment thoughts we as parents might have all the time by things our kids are saying. And it tends to not be a very helpful thing to say in those moments. Instead, you try, I don't like how you're talking to me. That's fair. You don't have to like how your child's talking to you. Can we talk about this in a different way? So I still want to hear you. Can we talk about it differently? And sometimes you might even want to say, and what I've said to clients before is, it's easier for me to understand and help you if you're not yelling at me or if you're not calling names. I want to be able to help you. And can we talk about it using calm words instead? Another potentially unhelpful statement: you're always so manipulative. Instead, we might want to say something like, it's easier for me to understand and help you when you're direct with your words about how you feel and what you want. I want to know how you feel and what you want, and I want to be able to help you to the best of my ability. Can we talk about this directly? We really want to avoid extremes, okay? Extremes tend to be resulting from intense emotions to begin with. So this may be like all or nothing, black and white thinking, can lead to extreme emotions and extreme behaviors, and can often be really invalidating. Like if we're saying to our teen, you're always being so disrespectful. You're never following rules. You're never doing what I ask. That's probably not true. It's not often the case that someone is always or never doing something, right? There's usually more nuance to that. And if we're not acknowledging that, then it can feel really dismissive and invalidating of that other person's efforts. And it really causes us to ignore truth in that moment. Often what's more likely true is that there are sometimes when your teen's not following rules and sometimes when they are. There's sometimes when they're speaking to you with kindness and sometimes they're not. And we have to acknowledge both sides of that, or else they'll feel so dismissed and feel really unmotivated to continue to try on with behavior change if their efforts at behavior change aren't being acknowledged. We want to move towards balance. So again, we're wanting to slow down. Extreme thinking and statements tend to come quickly and impulsively and a result of a big emotion. So we want to slow down and look at the truth in both sides of the situation and find a balanced way to look at it. Instead of either or, we're thinking both and. We're wanting to see that multiple things can be true at the same time. It's not just a binary either this or that. And we really want to avoid generalizing by saying things like I mentioned, you always do this or you never do that. In most scenarios, when your child is upset or emotionally dysregulated, it does not help to jump to problem solving first. That tends to be experienced as highly invalidating, in part because, they may not want a solution at that moment. They may maybe what they need is to just be heard and validated and to have someone feel like they understand that they care. They may not be wanting a solution right then, and that's okay sometimes. Sometimes a solution really needs to be generated, and we're not going to be able to have that conversation until the validation happens first, until they feel heard, and until their emotions are accepted and acknowledged in that moment. So, a lot of us parents are uber problem solvers, right? We want to get in and be like, yes, I want to fix this for you, child. And it's like, it's understandable too, because we don't want to see our child stuck or in pain. We want to get in and fix it for them. And we have to slow down first. We have to slow down and take a moment to pause and validate their experience and the emotions present. So I see you're so upset about this. I'm so sorry that happened today. And it makes total sense why you're feeling that way. I get it. And then maybe instead of even jumping to problem solving, you can ask what would be helpful to them. So what do you need right now? Do you want to just tell me how you feel and we can talk about that? Do you want to help with coping skills, right? Do you want to have help with coping through this difficult feeling? Or do you want help solving a problem? Sometimes there's concrete steps we can take to solve a problem, and that in itself would lower the dysregulation. Other times there might not be. And so it's really just about tolerating a problem that can't be changed in that moment. But we can't necessarily decide that for our teen. We may want to really understand from them what would be helpful. Now, if they never want to problem solve, they always just want validation, and their problems continue or even pile onto one another, that's something to talk with their treatment provider about if you have one, because at some point, we want to reflect that. It seems like we're staying stuck in the same situation. I understand like change can be difficult and you may not know what to do, how to make things different. And it sounds like it's time for us to start to try. But generally speaking, especially when things are heated, always slow down to validate first. And as I briefly mentioned before, I cannot emphasize enough the importance of taking breaks. Because again, we're giving space in that break to ride the wave of an emotion. Even if our teen may take longer to ride that wave, for us, perhaps we need a minute to ride through the most intense part of that, to get space from what's causing us to be heated, and then come back to be our more effective selves. We're going to disrupt this cycle, basically, that we talked about before. Put the problem on a shelf briefly, go take your breaks, and then come back together and have a more effective conversation about it. I think that a lot of conflict I've seen and a lot of these cycles I've seen in families come from not taking breaks when it's really, really needed. I know sometimes it's hard because when people are amped up, they're like, no, let's go at it right now. We got to do this. And it's almost always a diminishing return situation. Taking a break could be monumentous. As I get to the end of my slides, I wanted to share some references and resources. Much of what I've talked about here is from Marsha Linehan in her work in developing DBT. And so a lot of the concepts I've talked about with emotion regulation, the biosocial theory, all of that is directly from her original text on borderline personality disorder and DBT treatment for that. For you as parents or other caregivers, I have a couple of resources to share. These are both great resources for people who have children with intense emotions. So we have Parenting a Child Who Has Intense Emotions, and we have The Power of Validation. I think you'll find both of these on Amazon easily. And if you're interested in learning more about these skills and how to apply them to your child, I highly recommend doing some reading here. We will be posting within the next couple of days on our website with the slides for the presentation. I'd also encourage you, if you're interested, to attend our free virtual parent support group. If you're feeling really stretched with what you're managing, this is open to the community and is free. So if you want to scan the QR code here and sign up to join, please do, and we'd be happy to have you and help you.